Hello, my name is Susan Lampe, and I'm an alumna of the University of Minnesota School of Nursing and a member of the Heritage Committee. The end of World War II brought the hope the healthcare system would thrive with a nursing workforce that had responded so well to the challenges of war. However, recovery from the war was not so smooth and promising in the eyes of many healthcare leaders as they confronted severe nursing shortage. We will highlight the recommendations of these healthcare leaders and how Director Katharine Densford and the faculty of the University of Minnesota School of Nursing modified the curriculum and assumed roles in state, national, and international healthcare policy and organizations to address the challenges. Hospitals and other healthcare facilities had languished during the war as resources were diverted to waging war. By 1945 and the end of World War II, many American hospitals were obsolete, and approximately 50% of the nation's counties had no hospital facilities at all. Among the responses was the Hill-Burton Act of 1946. The act ushered in an era of feverish hospital construction and growth that led to a 26% increase in hospital admissions between 1946 and 1952. One of these new facilities was the University of Minnesota Hospital, the Mayo Building. More and more care moved to hospitals. Unfortunately, the Hill-Burton Act did not provide for the increased nurse staffing needs of these new facilities and patients. In addition, enrollments in nursing programs that had increased from about 64,000 in 1935 to over 126,000 in 1946 declined to just 92,000 by 1948. Increasing demand for nurses to staff hospitals led to serious shortages. In the midst of the post-war nurse shortage, hospitals met their nursing care needs by establishing their own diploma schools. The stage was set for future struggles regarding the basic entry requirements for their profession that played out in subsequent decades. The war had drawn nurses to assume larger roles and responsibilities. They had discovered and mastered new challenges and opportunities in their practice and education. The healthcare system was not ready for this larger nursing role. As a result, the hope that returning nurses could use their newfound capabilities was only partially realized. In addition to leaving for marriage, nurses who had served in the military and failed to return to their former positions cited reasons such as old hierarchical roles with limited opportunities for promotion, low rates of pay, and lack of retirement benefits. Anticipating the challenges to nursing after World War II, the 1945 National Nurses Planning Committee proposed a comprehensive program for nationwide action. This led to 4 major studies to address these 5 areas for development. Of these, the study by Esther Lucille Brown was especially important for the School of Nursing. A social anthropologist, her landmark study, Nursing for the Future, was credited for promoting major changes in nursing education and service. These 4 studies came to similar conclusions. Their recommendations included dividing nursing into 2 levels of practice, professional and practical technical, moving the education of professional nurses from the apprenticeship model to 4-year college programs with integrated academic and professional curricula, extending nursing services into the community with health as the central focus, increasing specialties in nursing with special attention to clinical specialties and public health. Nursing and medicine in cooperation should address the long neglect of mental health clinical interventions. Recruiting students so as to represent a true cross-section of the population. Educating practical nurses in hospitals or educational facilities such as vocational education programs. And improving salaries and working conditions for nurses and providing retirement funds for nurses. When she came to the university as director in 1930, Katharine Densford had named several objectives for the School of Nursing. 3 of the objectives were closely related to the recommendations of the 4 studies. First, she wished to increase awareness of normal health as a basis for preventive and curative care. Second, she wished to emphasize the social science aspects of nursing. And third, she thought practice should be based on sociologic and scientific principles rather than performance of tasks. In the fall of 1946, the school admitted the last class of 3-year diploma students. From then on, only candidates for the baccalaureate degree would be admitted. By September 1949, the 5-year baccalaureate program was redesigned to a 4-year curriculum, giving students a broader grounding in general education and a focus on nursing as a social service. In addition, specialized baccalaureate programs for registered nurses were established in nursing education and nursing administration. Katharine Densford, as president of the American Nurses Association, sent a survey to active military nurses asking what they wanted to do when they returned home. In response to their data, and with the help of the Kellogg Foundation, the School of Nursing faculty developed and offered specialized clinical courses. The courses prepared registered nurses for advanced levels of functioning in their new civilian jobs. The public health nurse continued to play an important role after World War II, when there was a call for increased numbers of nurses to meet the needs of families within the community. Advances in medicine and nursing were applied to improve the care of families and communities in public health nursing. While the School of Nursing, in cooperation with the Medical School and the Public Health Association, had offered the first public health course to nurses in 1918, the new 4-year baccalaureate program included clinical experiences in public health nursing. One of the students in the 1918 course, alumna Pearl McIver, became Director of Public Health Nursing for the United States Public Health Service in 1944. Veterans returning from the war had a high incidence of mental health issues, and the federal government recognized the dire need for nurses and medical professionals trained in psychiatric and mental health care. The National Mental Health Act was passed in 1946. It made available increased funding for training professionals and conducting research in mental health diagnoses and treatments. In addition to expanding the curriculum in the Bachelor of Science program, a psychiatric nursing certificate program for registered nurses was offered. Esther Lucille Brown, in her study, challenged schools to recruit students more representative of a true cross-section of the population. In answer to this challenge, the first 4 men were admitted to the School of Nursing in 1949. The shortage of nurses also led to national interest in developing a second level of nursing practice. In 1939, the School of Agriculture proposed a home practical nursing course in the school's home management program to assist rural physicians and complement its programs for rural men. Director Densford and Lucille Petrie of the School of Nursing provided consultation reluctantly. They did not favor the idea because they believed education of nurses should be done by the School of Nursing. The School of Agriculture designed a practical home nursing curriculum in 1941, although it was not implemented. However, in 1946, the administrator of the university hospital and the dean of the medical school announced that the university would start a practical nursing course in or out of the School of Nursing by January 1947. Densford took this opportunity to launch another practical nursing program located in the School of Nursing. The University of Minnesota School of Nursing program of practical nursing served as a trial for Densford's idea that it should be a 4-quarter program that was entirely an educational experience without a requirement that students staff the hospital for their clinical education. The students were required to be high school graduates and pay for everything associated with the program. Student clinical training was under the control of the school rather than the hospital. The program was approved by the General College so that following 1 additional year of study, credits would apply toward an Associate of Arts degree. This program was conducted from 1947 until 1967. Alma Harvey was the first instructor. Marjorie Low was designated to develop a 6-quarter joint program with agriculture and nursing to provide practical nurses for rural hospitals, public health programs, and individual patients. The program was the first of its kind in the United States to combine preparation in home management and practical nursing. Eugenia Taylor was responsible for instruction, including supervised practice of students in the actual care of patients. The University of Minnesota School of Agriculture and School of Nursing Home Management and Practical Nursing program began in 1949 and was closed in 1960. The School of Nursing ran both programs simultaneously for 11 years. Director Densford believed the goal of nursing organizations was to work cooperatively to promote better nursing. Her leadership continued in national and international nursing organizations to address the challenges of the post-war period. Among the organizations in which Densford made contributions to the post-war needs of nursing were the American Nurses Association and the International Council of Nurses. Densford served as president of the ANA from 1944 to 1948 and vice president of the ICN from 1947 to 1957. As president of the ANA, Densford was invited to be present for the 1945 conference that led to the United Nations Charter that addressed the need for a health program to raise the world's standard of health. The ANA invited the ICN to hold its first post-war Congress in the United States in Atlantic City, New Jersey, in May of 1947. Densford hosted 5,000 nurses from 32 countries, challenging participants to turn to the tasks of peace, to rebuilding and strengthening the nursing schools and nursing organizations of every country, and creating an environment in which the health of mind and body can flourish. As ICN vice president, she traveled extensively, encouraging nurses to act as world citizens and share the responsibility of working to improve health. In 1946, the ANA followed the recommendation from the 4 studies of nursing to address economic security of nurses. The ANA would represent all nurses in questions of employment and economic security, including collective bargaining and negotiation. The American Hospital Association argued that a professional organization could not be a bargaining agent. Densford countered that nurses needed to seek contractual agreements for improving work conditions and salary scales, but cautioned that we must do good service to get good salaries. And she emphasized there will be no strikes, the patient comes first. Eventually, as ANA president, she had to support a threatened strike by nurses, even though she did not personally believe in nurses striking. Densford personally supported mandatory health insurance, but as ANA president, she stood behind the organization's decision to take no action on that initiative. Staff, faculty, and Director Densford could be proud of their accomplishments during the post-war years as they responded to the challenges in the landmark nursing studies. The School of Nursing created a 4-year baccalaureate program for registered nurse preparation, extended clinical education to rural settings with emphasis on families in the community, increased clinical specialties in nursing, admitted the first class with male students, developed a pilot practical nursing program that prepared a technical nurse, led the ANA to improve salaries and working conditions for nurses, participated in ANA and ICN to impact international nursing within the context of health. The School of Nursing celebrated its 40th anniversary in 1949. The article in the April 1949 Minnesotan emphasized, "Looking forward is something that Katharine J. Densford and staff do consistently." We have outlined how that forward thinking provided the post-war promise of continued growth of professional nursing education at the University of Minnesota School of Nursing.